Now there's another dementia that's related to Parkinson's disease called Lewy body disease. And we find that this is more prevalent than we ever thought in the past. Usually what will bring somebody in with Lewy body disease is falls. A lot of falls. Falls because you have Parkinson-type symptoms, and falls because it impacts your visual spatial processing. It does something else. It creates visual hallucinations. And it doesn't mean the person's going crazy. Actually, these are well-formed hallucinations, usually of animals or of people. And so I've had patients tell me, there's a little boy, he's got freckles, and he comes into my room, he's wearing green lederhosen. And I know he's not real, but he looks so very real to me. And so it's not demons and psychotic kind of thinking. We have to be careful with Lewy body disease, Lewy body dementia, because if they're treated with psychiatric medications, if we treat it as if it were psychiatric, the Parkinson's symptoms get worse because we've already got Parkinson's problems in here, and many of those medications have a chemical called dopamine in them, and they cause worsening of those symptoms. Sometimes can be fatal. So we have to be very careful when we have visual hallucinations that are well formed in somebody who's never had anything like that in their whole life. So it's not the eye that's the problem. It's back where we put the images together, back deep in the brain, where that problem arises. Oftentimes, with patients with Lewy body disease, we'll see them because they've had a number of auto accidents. They've gone to the primary care doctor and they've hit the dumpster and they've hit other cars, and they have trouble getting into that parking place that seems to be just fine, but they ding their car every time they do that. That may be a patient with Lewy body disease. In fact, some people think that if you have Alzheimer's disease, that means you can't drive. Well, that's not necessarily true, because in the early stages of Alzheimer's disease, it's memory that's affected, not the front of the brain or the cerebellum. So the biggest fear is that you'll get lost, but you'll get lost safely. You may run out of gas. Those aren't things that we worry about. We know that early on, patients with Alzheimer's disease can drive. We're more concerned with patients that have strokes or other kinds of dementias. And also with Lewy body disease, there are fluctuations in attention and alertness. So often these patients or people with Lewy body disease will look off into space and then come back, and look off into space and then come back. And one other dementia we'll talk about is frontotemporal dementia. And frontal dementia happens usually much younger, often runs in families, and it happens ages about 55 to 65 is typically where you see people with frontotemporal dementia. Now, our frontal lobes act like a traffic cop. They kind of keep things, they inhibit our just reacting any way we'd want to. Now, children don't have a lot of myelin, that fatty wrapping in the front of the brain. They develop that over time. So they want immediate gratification. That's really what we often see with people with frontotemporal dementia. I had lunch. I had 14 cookies. Or they say things that is a change for their personality. It's not typical. There's something called utilization behavior, where they might sit at my desk, and while I'm talking to them, they kind of look around, pick up a picture. Is that your wife? He doesn't look too great to me. You know. I had a patient who, at the salad bar, cuts. No, get out. And wanted to get to the front of the line. Was afraid that people were going to take all the good stuff. So usually what we see are immature behaviors, emotional disturbance, and kind of temper tantrums. And those would be typical of somebody with frontotemporal dementia. It wouldn't be memory, because that's the front of the brain that's affected. It used to be called Pick's disease. Now let's talk about good stuff. What can we do about all this? Diet is one thing. In fact, medicine is taking a closer look at things like omega-3 fatty acids that you get in salmon and swordfish, flaxseed. It wasn't that medicine ever thought that those things weren't helpful. There just wasn't a lot of research behind those in the past. And now the National Institute of Health and other organizations have done studies and found that indeed these are helpful. Berries, any kind of berries. We found that they work as antioxidants, and they will decrease inflammation in small vessels. So any kind of berry. There's some really good ones: blueberries, chokeberries, lingonberries, raspberries, strawberries. If it's a berry, it's probably good for you. Now, here's where the research shows us that there is no doubt exercise is the best thing you can do for yourself. Use it or lose it. People talk about the brain that way. And actually, that's the myth. It's not use it or lose it with the brain. It's use it or lose it physically. There was Dr. William Buchan, a Scottish doctor, physician, who said that of all the things that can make man's life short and miserable, there's nothing with as much influence as lack of proper exercise. And they did the study in the 1960s in Dallas. They took these college students and they were in shape. They said, we want you to stay in bed for 3 weeks and we're going to pay you to do it. Well, that sounds like a pretty good experiment to be involved in. What they found was their hearts didn't function as well towards the end of the 3 weeks, that the cholesterol levels started to go up, that they quickly started to lose muscle mass and increase body fat in just 3 weeks' time. So not moving. No matter what, as we age, the more we're moving, the better off we are. If we want to stay active and healthy, then we have to exercise. And if we exercise, then we don't lose other things in our life. Like sex, for example. We know that touch is very important, and intimacy. And you give off hormones, and there's stress-relieving properties of sex. And I put this up here because I thought of a study where they showed that people who drink 3 cups of coffee or more a day seem to have a better sex life as they age. And I was wondering, maybe that's just because they're the ones that stay awake. Now, you'll hear a lot about games and puzzles and stimulating the brain. All this sounds just wonderful. The American Academy of Neurology did a meta-analysis. They looked at all the studies out there, found out which were good scientific studies. And there really aren't very many studies at all that show that reading and puzzles and social stimulation do anything to guard against dementia. Dementia is a disease process. You know, that's the neurofibrillary tangles, that's the strokes, etc. Well, how the heck did they come up with this idea? One, it's big business. So we find that a lot of companies that produce these games actually have done the research on their game and says this is just wonderful. And what they also show is that if you continue to play their game or do their puzzle, your scores increase. So you must be getting smarter. But unfortunately, we find that getting good at that game doesn't generalize out into your real life. Where did they come from? One is animal studies. One is animal studies involving deprivation. So they took rats and they put them alone without much light and without much stimuli, and these were young rats. They took other rats and let them be with more of their own species. They put tread wheels and all kinds of stuff for them to interact with. And then after 6 months, all the rats dedicated themselves to medical science, and we looked at their brains. And what you find is that the deprived rats had much smaller brains than those who were active. Well, that doesn't mean being active and stimulated as we age makes our brains hold up better over time. Here's part 2 of this. We didn't know when we started doing studies about something called mild cognitive impairment. Now we think that mild cognitive impairment might be a precursor to Alzheimer's disease. In other words, it might be the disease itself. Because we know over about a 5-year period, about 80% of those people with mild cognitive impairment look like they will convert over to Alzheimer's disease. What happens in mild cognitive impairment? That's when people stop reading, stop square dancing, stop doing crossword puzzles. So it may well be that it's the disease is the reason they stopped, and it's not that you kept doing it, you didn't get the disease. So those that kept doing it just didn't have the disease. But the good news is exercise. If I told you there's a pill, if I got a pill, just drop by my office, and this will lower your cholesterol. It'll lower the bad cholesterol. It'll raise the good cholesterol. It will lower insulin, lower blood sugar. It will reduce the risk of depression. It will reduce memory lapses. I'd have people lining up. Well, we have that pill, and that pill is actually exercise. Cardiovascular exercise, aerobic kinds of exercise. Why is it so beneficial? Well, I showed you all those pathways and all those little small vessels. And our brains shrink, I told you, because we don't get enough blood perfusion. Well, if we exercise, our hearts beat harder and we send blood deeper into the brain, and our brains hold up better over time. In fact, research will show you that if you have a regular cardiovascular exercise program in place, you're 3 times less likely to get dementia of any kind. See, we don't know necessarily what's also linked to when that dementia may start. Finding with NFL players, is it a certain number of concussions? Is it a certain number of small little strokes? Because we know with Alzheimer's disease, 35% of those people also have small vessel disease. So are there things that in the environment that sort of weaken the brain so that eventually we develop Alzheimer's disease? Alzheimer's disease, the biggest risk factor for it is just increasing age. The older you get, the greater the risk. People say, well, is it a genetic disease? In some respect, but people shouldn't get excited if they have a parent who has Alzheimer's disease. All of us in this room probably have an 18% chance in our lifetime of getting Alzheimer's disease. If one of our parents has Alzheimer's disease, our risk factors may increase to about 23%. There's not a big difference between 23 and 18. Certainly not enough to fret about. And it seems to be the endurance kinds of exercises. The more you can do of something, walk longer, ride a stationary bike, it's the treadmill, it's swimming. Those are the kinds of things that help you hold up better over time. Exercise to protect your aging brain. And that's about where I'm going to come to an end. I think our hour is up. We're only a half hour, right? Well, holy mackerel. Well, we can start to take some questions then. I like questions and answers. But I think as a society, we really struggle a lot with exercise. I think people rather have a pill, or people rather play a game on the couch. And unfortunately, our bodies are designed to keep moving, and that's how we're going to protect our brains. And I tell people, if you don't like the word exercise, just call it your brain restoration or your brain maintenance program. You're holding on to those brain cells by exercising. And with that, let me kind of open it up and and take some questions. Yes, ma'am.
I've been told that if you don't go to a gym or do the proposed exercises, treadmill, lift weights, what have you, that any other exercise you do, it really doesn't count. But I do 25 different exercises before I get dressed in the morning. I mean, I start the minute I wake up, and I figure it can't hurt me. It may not help me, but it can't hurt me.
Well, whatever you're doing is better than sitting on the couch, right?
I don't have time to sit on the couch.
Good for you. Good for you. And if your heart is increasing, beating faster, we know that's good. That's how blood and oxygen gets deeper. And that's really the problem with aging. Yes, ma'am.
You said with dementia that it goes to the storage area and the storage is empty. But how does it get empty? Because at one point there is storage.
Right.
So what's the mismatch?
Memories from long ago are stored away, and we think maybe even separately from the hippocampus. The hippocampus is our memory factory. And so when we learn something new, it eventually goes from the front of our brain into the hippocampus. But by empty, what I mean is it's like sand in an hourglass. We put it in there and it drains away. So with each passing minute, I can ask patients 5 minutes after I've given them something, 15 minutes after I've given them something, half an hour after I've given them something, and the information just slowly fades away with Alzheimer's disease. It's tough to hold on to. And they search. We know they search. There's a task where they have to name as many animals as you can possibly come up with. And with functional MRI, we know that those first 7 animals or so come off the front of your brain. And then something interesting happens. You shift to the hippocampus. So there's a small break between naming those first animals, and then you can see people will go to Africa. Lion, tiger, zebra, small gap. Then they might go to the barnyard, a hog, a cow, a horse. Typically with the Alzheimer's patient who struggles to get beyond 10, 11 animals, they give you those first 7 or 8 animals. And then there's a long gap. And during the gap they usually say, well, this is a kid's game, I don't like it. I don't like animals anyway. Not things you necessarily hear from people who can give you animals. Then, in about the last 15 seconds of a minute's time, they'll say, oh, I know some more. And they go right back to the front of the brain, and they'll usually give you the same ones they initially gave you. So what I mean is they go to search, and that area is empty. I don't have information in there. So they go somewhere else in the brain to get that information. So what was stored in there is empty. That's what I meant. Okay? Yes, sir.
In February, I was diagnosed with Parkinson's disease, and everything you said tonight is in this book. It's called Use Your Brain to Change Your Age by Dr. Daniel Amen. It's a great book. A couple of things he talks about in here is get rid of sugar, get rid of nicotine, and caffeine. Do your exercises, learn a new language that helps the brain, but and then he talks about SPECT scan, which I had because I didn't know what I was having when I had it, but it's a nuclear test. It takes quite a while to get done by the time you take all the medicine. But everything you said is right in his book.
Well, great. Thanks for sharing that. Yes, sir.
So if you have high cholesterol, does that speed up the small vessels in the brain for what?
Good question. Cholesterol is a plaque. So think of a river with debris on the side of the river. And the debris is your cholesterol. So if the river picks up small pieces of the cholesterol and carries it downstream, that little bit of cholesterol, that plaque might get through big veins and arteries, no problem. But when it gets down to those little vessels, it'll clog them.
But then they'd be lost.
Well, it's like damming up a small little stream. If we're not getting our blood down past that stream, we end up with a small area of cell death. Very small. But that's the problem. You get a pockmark. You get lots and lots and lots. So the information still gets through, but it just doesn't get through as quickly as it did. Yes, ma'am.
Have you had much success with medication once they have diagnosed with Alzheimer's?
I'm glad you bring that up. For some people, that's controversial. Not so much for me, but I think it's because of expectation. Because we do have medications, and those medications have been shown to slow down the rate of memory decline. Unfortunately, sometimes people say, take this medication, it's going to improve their memory. And then I'll find people came off the medication a year later, and I'll say, well, why aren't you on the medication anymore? And they'll say, well, it didn't work. How do you know it didn't work? We didn't see any improvement. Well, you're not going to see improvement. It reduces our rate of decline. So sometimes if we're not careful about setting expectations, but what we do know is no matter who you are, what the rate of decline is, it slows down on these medications. So we don't have a cure. But I'm glad you brought that up because our population is aging 3 times faster than the younger population. And we keep people alive longer than we ever have because we can take care of hearts and all kinds of other things. So I said the risk factors are just aging. Pharmaceutical companies, they know this, and not necessarily out of the goodness of their heart. They look out there and they say, well, where are the most people we can impact? Well, Alzheimer's disease. So they're putting all their money and their best scientists and all their efforts into trying to come up with something better. Because they know if they crack that, and I think Alzheimer's disease has been like what cancer used to be, that scare in the 50s and 60s where everybody used to just say CA. You know, they didn't even want to say it. And now it's been replaced by Alzheimer's disease. So they know there's fear out there, and they're doing everything they can. So with that much money and that much brain power and that many resources, I can't think that we're not going to finally stem this and come up with something that's much better than what we have. But if we can reduce the rate of decline, I'd want somebody on that medication because I'd want them here when something better comes along versus down here if they weren't on the medication. But some people get discouraged. They say, well, it's not a cure. I didn't see any improvement, and they decide not to take it.
I was talking to a friend of mine probably 5-6 months ago, and her husband had been diagnosed, and she was just beside herself. He was wandering at nighttime. He'd take off and wander the neighborhood, and he was starting to get really belligerent and mean. And I'm going out there just into this week, but I talked to her, and he's on 3 different medicines, but he is doing great. Now, like you say, he's still not interested in the paper, he's still not interested in the puzzles, he's still not interested in those things, but he's manageable now. And even to the point where she can leave him alone now for a few hours.
Yeah. Thanks for sharing that. Well, I got to give this lady way in the back there with the red.
Wondering if does a concussion interfere with aging the brain, and if so, how? And I was thinking of Muhammad Ali.
Yeah, there used to be something called dementia pugilistica, the punch-drunk fighter, right? And we think that may have been from repeated blows to the head. Now, he has Parkinson's symptoms, and we're not sure that necessarily brought that on. But we're kind of thinking of the brain almost like a cat with 9 lives. And so you can bang it around a certain number of times, and genetically, you may be set for 2, and you may be set for 8, and we don't know what that is. But the brain may only be so resilient. And we're looking at hockey players and NFL football players now that have had a number of concussions, so many they've lost track. And we're finding their brains look like Alzheimer's brains, and they're 50 years old. And it has some of the same pathology. So it somehow kick-started this disease. So I always say, if you're going to do things that are dangerous, you might want to wear a helmet, and especially if you've already had a head injury, because that increases your risk of having another one. And we don't know how many you can take that in the end will end up being too many. That's a good question. Yes, sir?
I believe this is a fairly new concept, but do you have any thoughts or do you have any opinions on this neuroplasticity? The fact that you create pathways within the brain, you're not set.
Yeah, that's really interesting research. And especially, I'm up on the rehab floor on the 6th floor, and they found that there are things that affect your chemistry, your brain chemistry. And we've known for years that those people that are depressed, for example, don't seem to do as well as those who are more optimistic. And it's not just being optimistic. We think it's chemically induced, and if your chemicals are right, it may create a propensity for growth of axons. And we never thought that you could recover that in later age. And we're finding to some degree you can make changes. And that's all cutting edge right now. So you can't say, this is how to do it, or, put a hat on that shocks your vessels or things, but certainly that's an optimistic finding. And there are things that we used to believe that now are just go by the wayside. So there are lots of new things that we can't even imagine in this day and age. Remember, doctors used to say, take vitamin E, take lots of vitamin E, it can't hurt. Until we did studies and found out, well, if you take thousands and thousands of milligrams of vitamin E, it increases mortality and increases bleed, so it's probably not a good thing. So even things that we used to think were benign aren't necessarily. So, yes, ma'am.
Could you give a few more examples of natural aging of the brain as compared to Alzheimer's? Because I'm kind of worried about this. I want more examples.
Being worried is actually a good sign. I think all of us, once we reach about age 50 and we lose our car keys, we think, uh-oh, we got it. Forget that we lost them when we were 20. Often what happens is you'll start to see emotional changes. A lot of drives that were there just aren't there any longer. It may even look like depression. So the primary care doctor says, well, it looks like depression. But these will be people that have never had a history of depression, and now they're 70 years old, and they start to look like that. And they'll put them on an antidepressant and not really get much bang for the buck. They don't really look different. And then that doesn't mean if you're depressed or have depressive symptoms, but that's kind of a flavor of what happens initially. The forgetfulness, like I say, the hints and the cues don't seem to bring that information back again. I gave an example of the mailman who came, and you can't remember the name. Somebody with Alzheimer's disease, even if they were worried about it initially, are just going to let that go. Does that help?
Yeah, thanks.
Yes.
Okay, so we're talking about the aging brain, and with menopause, for women, how is that as far as the hormonal changes? And it's just like sometimes it's like a foggy brain, and things just don't come up. So how much of that is really hormonal based? How much of it is, well, I mean, menopause is all because you're aging, but I mean, is there, what are they finding as far as bringing in, hormone therapy in there?
I think women have been shortchanged for years because women will talk about problems in pregnancy and problems in menopause. And I think in the past, in the 50s, the people used to end up saying, oh, she's just wacky, and it's all emotional. It's all psychological. But now we know that hormones play a tremendous role. I don't want to speak to something I have not read the research on, but I know that it's an area that in the past has been sorely neglected, and it does affect women cognitively, and it's a disservice to tell them that it's psychological and it's emotional.
And as far as stress, how, I mean, is that another factor where sometimes the processing isn't clear because you have so much stress that it's just like things aren't going through clear?
Absolutely. Remember I said that everybody sort of thinks that they have Alzheimer's disease? That's because our society, if you try to even watch the news, here's the news, there's a ticker tape on the bottom, there's a little box over here, we're just inundated trying to keep up. We know that we start to look at things like cortisol in our blood. Those levels seem to be going up in a lot of people because of the stressful lifestyles we're forced to.
Like I'll find like I'll be writing something and all of a sudden I'll look and it's like I'm missing 3 letters. I've got the first letter right and I've got the end letter right and it's like what happened in the middle? It's just like where'd it go? And when you go back and reread what you've written and it's just like this is ridiculous.
I saw a patient once that had 2 jobs and 3 kids, and they parked their car and they went off, and the guy at the gate at the front of the building said, are you going to leave your kids in that car? And they thought, oh, geez, how could I, what's wrong with my brain? Well, nothing's wrong with their brain other than you're just stressed and overworked. And in that situation, there was financial stress, and how am I going to manage all this? And certainly, things are going to fall through the cracks. So it's scary. I'm glad people bring this up and talk about it, because I think if you swallow it and think, gosh, I'm struggling, we're all struggling. It's tough to find a balance. Yes, ma'am.
Do you think there's any connection between celiac, someone that's had it severely for years, and Alzheimer's?
Repeat that question.
Yeah, if there's a connection between celiac and Alzheimer's, I can't really tell you. That I wouldn't know. But you certainly have piqued my interest, so I'm giving a talk on, I think, February 6th, so by then I'll know. Yes, ma'am.
I was just wondering how having CAT scans and a numerous number of them over a few years or whatever, because of a brain surgery I had and everything, how much damage, if any, does CAT scans do to your stuff in the brain?
Well, there's certainly a cost, risk-benefit sort of thing, but in certain situations, I mean, they're safe. They're in essence safe. You do get some radiation from them, that's true, but that payoff versus do we have a tumor that's reappeared?
Well, I just was wondering, I had subdural hematoma, bleeding between the
Yeah.
veins and the
Uh-huh.
had to have surgery one day, and the next day we had to do it again because they didn't get it off. But I had numerous number of CAT scans even to find it. They didn't over a period of 2 days, and then I had in the next year I had several more just to keep track of how it was.
There's some risk, but it's not like we're just zapping you with a laser gun, But there is some risk. But versus the risk of not finding a bleed.
But I mean, is that risk? Is that decreasing the good?
Well, we use cell phones, and we think that that may be linked to brain tumors. But nobody's throwing their cell phone away as a result. So I hear what you're saying, but I don't think it's something you have to. I think the risk is quite small, and especially the risk versus what we had to do to help you medically is. Yes, ma'am.
Can you comment on any research done on caffeine effects on the brain? And then what would you say is the recommended dose for omega-3 fatty acids?
I don't know the recommended dosage, other than we found that it's good for you. in terms of caffeine, I read all the studies that say you should drink caffeine because I love coffee. But you find it's all over the place. And you know, they link it to Parkinson's disease, but then they say you're not going to get Parkinson's disease if you drink coffee. That research is still all over the place. We know caffeine gets you pretty buzzed, and we don't know how good or bad that is, and ulcers aren't good, etc. But I don't know that the research is definitive on caffeine. But if I get up to, wherever after I pass away and I find out that donuts and beer are good for you after all, I'm going to be darn mad.
In relation to the question on caffeine and the levels of fatty acids, how much research is being done on personal biochemistry? Is there any way to predict what levels are within different people? Much like the old cultures that they used to do to find out what kind of a virus.
Right.
You mentioned people getting buzzed with coffee. I have the opposite. I go to sleep.
Yeah, so do I.
And it just, some people have very opposite reactions to some medications.
Maybe I can find somebody who deals in this realm, since that question seems to be coming up a lot, and then I can ask Sarah if we can bring them up here and have them talk to us, and I'll be in the audience myself.
In the early 1970s, my father-in-law was diagnosed with Alzheimer's, and they told us that they couldn't really say for sure that's what it was until they did an autopsy after he died. What is the diagnosis now?
We know in our testing we can be about 95% accurate. And that's because the disease follows the anatomy. What I mean by that is it starts in memory in the hippocampus and slowly starts to move backwards. On the right side of the brain, it starts to affect visual spatial skills. So that's why the doctor will often ask somebody to draw a clock. Over on the left side, it starts to affect language. So that's why we'd ask people to name animals. And you can almost see it go from the memory to those other areas and follow a pattern that you don't see with about anything else. There are people that pathologists will, at autopsy say, you know what, there's an awful lot of neurofibrillary tangles here, and the person never was diagnosed with Alzheimer's disease. But we're getting pretty accurate at finding, and even in the early stages, with mild cognitive impairment, which may lead to Alzheimer's disease, we're even getting pretty good at figuring that out. And we think some of the scans, and they're talking about now cerebral spinal fluid analysis, so I think we're going to pretty soon be pretty close to 100% accurate. But you're right. We used to, before we even knew how to do these, everything was senile dementia, right? Right? Everybody knows that old term. Let's take one more question. Yes, sir.
Can you tell from a SPECT scan if you've got Alzheimer's?
We don't use it much for Alzheimer's disease. What we do is we look for where your metabolization of a radioactive ligand that we gave you. So they gave you some kind of chemical, right? And let's say for Parkinson's disease, it attaches to the dopamine system. So then, if we take a SPECT scan, what will light up? If that dopamine system's not lighting up for us, we know that you're deficient in dopamine. And that really is part of the diagnosis of Parkinson's disease, because you don't get symptoms till you're about 70% deficient in dopamine. But we can't use it in the same way for Alzheimer's disease. Unless, I haven't talked to the neuroradiologist here, and maybe there are times that they use it, but I don't know that I've heard it used to make a diagnosis, or that comes to mind. All right. Thank you very much for coming. I appreciate it.